All right, let's jump right in. Today, we're talking about this massive split right down the middle of modern medicine. On one side, you have these incredible, mind-blowing innovations in surgery, and on the other, you have the stark reality of who can actually access it. It's really a tale of two different worlds, both revolving around the surgeon's scalpel.
I mean, just imagine this for a second. This is the future we're promised. Dr. Reza Lankarani puts it perfectly. Surgery becoming so precise, it's like having a GPS guiding the surgeon's every move. This is the world of AI, of robotics, of unbelievable sharpness. And it's not science fiction, it's happening in operating rooms right now. But, and this is a huge but, that's only one half of the story. And here's the other half. 5 billion. That's how many people across the globe don't have access to even basic, safe surgery. So while one part of the world is literally developing GPS for operations, most people aren't even on the map. That number, right there, is the whole challenge we're going to unpack. So first, let's explore that amazing cutting edge. We're going to call this the sharpness of the scalpel. You know, the pure technological genius that's changing what's even possible inside an operating room.
And this makes it so real. This isn't just some abstract idea. Get this, a new AI model can actually predict if a C-section will be needed with almost 92% accuracy. It looks at all these different factors and helps doctors make safer, smarter calls. This is personalized, predictive medicine, and it's happening today.
This lays out the path that innovation is on. You know, we started with robotic systems, which are basically super advanced tools guided by a surgeon. Right now, we're deep into stage 2, putting AI into the mix for predictions and diagnosis. Next up is real-time analytics during surgery, and the final frontier, the holy grail, is stage 4, autonomous actions, where a machine might perform parts of an operation on its own.
Okay, so for every incredible leap forward in sharpness, we have to ask about its reach. And this brings us to the other side of the scalpel, the tough reality of a world that is deeply, deeply divided when it comes to who actually gets to benefit from all this.
This table just lays it all out there. And wow, the numbers are stark. In high-income countries, you have more than 56 surgeons for every 100,000 people. But in low and middle-income countries, less than 4. The World Health Organization's target is 20. So one part of the world is blowing past the target, while the other is tragically behind. And you can see what that means for patients.
So here's the bottom line. The risk of dying after an operation is more than 7 times higher in a low or middle income country. 7 times! While one system is perfecting these incredibly complex procedures, the other is struggling just with basic safety. It's a huge gap.
So this gets us to the core question, right? Why? Why does this huge gap exist? Why doesn't all this amazing new technology just automatically lead to better care for everybody? Well, the reasons, they're complicated and they're systemic. Let's just start with the most obvious barrier, the price tag. A single one of these state-of-the-art surgical robots can run you up to $2 million. For a lot of healthcare systems out there, it's an impossible dream right out of the gate. And this really shows you the kind of tough choices health officials have to make. For the price of one fancy robot in one hospital, you could fund 100 community surgical clinics. That would dramatically expand basic care for so many people. It's that classic fight, right? Depth versus breadth. Or, as we've been saying, sharpness versus reach. But it's not even just about the initial cost. There's this whole tangled web of other problems. Like, who's going to pay for these procedures? How do you possibly train surgeons when 80% of the training courses are in wealthy countries? Then, you've got different rules in every country. And let's not forget the huge environmental waste from all the single-use parts, or the fact that only 1 in 6 studies on these new tools even meets the gold standard for evidence. It's a real mess. Now, I know this all might sound a little bit hopeless, but it's not. There is some truly incredible work happening to try and bridge this gap. So let's look at 2 really fascinating case studies from countries that are coming up with their own innovative solutions.
First, we're heading to Mexico. Their solution to this whole problem isn't about some expensive tech being pushed from the top. It's all about a community-led, ground-up approach. Let's see what that actually looks like.
Honestly, what's happening in Mexico is just a masterclass in being smart and adaptable. They are not sitting around waiting for a $2 million robot to show up. No. Instead, they're taking a successful model from India, the Community Health Worker Program, and adapting it for their rural areas. They're working with companies to bring health education right to the workers. And this is so important. They're engaging with local groups and translating materials into indigenous languages. That's how you make it work for real people.
Okay, now let's check out a totally different model over in Ethiopia. So unlike Mexico's bottom-up approach, they're going top-down. They're using national policy and research to build a lasting, countrywide surgical system.
Ethiopia is a genuine pioneer here. They were one of the very first countries in Africa to create a huge, comprehensive national surgical plan. They're leading the charge on training non-physician surgeons to fill those massive gaps in the workforce. They're even working with their neighbors to standardize care. It's just really strategic long-term vision.
So after seeing all this, what's the big takeaway? Well, it means we have to start redefining what we even mean by progress. It can't just be about making the scalpel sharper and sharper. We also have to be obsessed with extending its reach.
The experts are pretty clear on what a path forward looks like. We have to rebalance things. We need to fund scalable, low-cost solutions just as much as we fund the high-tech gadgets. We need to demand solid proof that new devices actually work before we rush to use them. And I love this idea, requiring surgical equity impact statements to force a conversation about who might get left behind by new tech. And of course, we need to put more money into global surgery research, period.
Which kind of leaves us with this final big question to think about. As we look at the next amazing surgical innovation, what's our real yardstick for success? Is it just the pure technical genius of the thing? Or is it measured by how many people all over the world it can actually touch and heal?
At the end of the day, it all comes back to this one simple, powerful idea. The future of surgery isn't just a technical problem to solve, it's a moral one. True progress, real progress, will happen when our most brilliant innovations are matched by an equally brilliant obsession with making